Recently, the Canadian Centre on Substance Use and Addiction has produced new guidelines for alcohol consumption. Many people that I've chatted with are surprised to hear what these guidelines are recommending. And this has been very good science. They reviewed over 5,000 papers on the effects of alcohol on physical and mental health. And for low-risk drinking, the recommendation now is no more than 2 drinks per week. This replaces the older guidelines that date from 2012, and these were substantially different. At that time, the guidelines for low-risk alcohol consumption were 15 drinks per week for men and 10 drinks a week for women, so that there has been a big step down. So the way to kind of think about this and interpret these guidelines is that there really is, for zero risk, it really should be zero alcohol consumption. But low-risk drinking for both men and women is now placed at 2 drinks a week, with moderate risk drinking, the number being less than 6, up to 6 drinks of alcohol per week, and anything over 6 drinks of alcohol per week being considered high-risk alcohol consumption. This is a drastic step down from what many people are used to, and it might, if they hope to have their behavior fall in line with these guidelines, it's going to mean a substantial change in their behavior for many people. There are some interesting differences between what the science is saying now about alcohol and what it said in the past. So at the level of 2 drinks a week, the effects on the body and the mind are probably similar for men and women. But once the level of alcohol consumption goes above 2 drinks per week, there are some substantial differences between how alcohol affects women and affects men. Most things in life do involve some risk. So drinking at a level of 2 drinks per week is probably in about the same risk area as driving a car, or flying frequently in an airplane, or walking as a pedestrian in a busy urban environment. So, so one has to make a choice about how one is going to behave around these new guidelines for alcohol consumption. But the thing that's important to remember is that if you reduce your alcohol consumption, there's some immediate benefits that you're going to experience. And that is, you'll probably sleep better. You'll reduce your risk for cancer and cardiovascular disease. You can have increased mood, and you probably have a happier liver.